health coverage you have right now?
Medicare and Blue Cross.
So you have Medicare and Blue Cross Blue Shield, and you're still struggling trying to pay for your medicine that you need.
Well, yeah. You get them in door hole and then.
Yeah, exactly.
Exactly.
Those are two big topics. I'm going to give you some short, concise answers. The war on drugs has been a failure. It's been an abject failure. It's turned a lot of people into criminals who are really individuals who maybe just needed help, who needed treatment, who needed to see this addiction or substance abuse as not a criminal act, but one that requires assistance. That's what needs to change here. I have legislation that would end the federal marijuana prohibition, because I find it unacceptable that we have people who are still getting arrested and have criminal records for simple marijuana violations. But at the same time, we have massive, big pharmaceutical corporations and high-paid executives and owners who are responsible for proliferating these highly addictive opioids on our streets, who are responsible for the skyrocketing price gouging that we're seeing in so many of these medicines that people depend on, like yourself, to live and survive, but they walk away scot-free with so much of the money that they have earned on the backs of sick people and suffering people in this country. With regards to Big Pharma, we've got to stop and end the prohibition of Medicare negotiating lower drug prices with big pharmaceutical companies. Our government is the #1 purchaser of prescription drugs in the world. We, the taxpayer, are the largest customers in the world for prescription drugs. So what that means is we have a huge amount of leverage in negotiations. We would be able to reduce the cost of prescription drugs if that law is stripped away, which is only there because of the lobbyists and PACs and the influence and all the money that these pharmaceutical companies put into buying a seat at the table so that they can actually help write those laws. The healthcare plan that I'll be putting forward in detail soon, but just in short, it's a single payer plus plan. Big insurance companies, big pharmaceutical companies who are driven by profits will have no seat at the table as we write the legislation for this plan. We'll ensure that every single American gets the quality health care